So sexual functioning is something that is not talked about often in medical encounters, in part because the healthcare provider is somewhat uncomfortable or very uncomfortable about this, and that happens for a dozen different reasons. I truly believe that oncology care providers have an absolute responsibility to raise the topic with their patients. And the research shows us that the healthcare provider doesn't talk about it, the patient doesn't ask, because if it was important, the oncologist or the oncology nurse would have brought it up, right? Because they bring up everything else. We talk about eyebrows and eyelashes falling out, we talk about nausea, we talk about yucky constipation and diarrhea and all those kinds of things, and yet often we're silent about sexual problems. So the patient is waiting for the healthcare provider to bring it up. Healthcare providers say, if the patient asks me a question, I'm more than willing to answer, and the result is a deafening silence. And that silence can continue essentially forever. Certainly there are some of us who are trying very hard to educate oncology care providers to talk about this, to include it in every encounter with a patient. It's not enough to talk about it once at the start of treatment. We have to keep talking about it and asking. And there are different ways of asking about it. However, if your healthcare provider doesn't ask about it, I think it's really important to name it in order to get help, because otherwise the assumption is that you're doing fine. So you may want to say quite bluntly, hey, I'm having problems with erections. Or hey, I'm having problems with orgasm, whatever it is. And maybe those words are hard to say or difficult to use. Then just use the language that you are used to using. We've all been through many years of education, and I've yet to see a healthcare provider faint at having to name an anatomical term.